All right, here we are today. Thank you. All right, technologically still working on it, but anyway. So Dr. Lena Edwards here, and I am talking with Andrea Mead. And Andrea is a phenomenal young lady who, I won't tell you how old she is, but she does not look her age at all. I was telling her I want to use whatever she's using. But anyway, so Andrea is one of these other women who was barely surviving, and her story is really influential and profound and really inspirational. And I really wanted to share that with everybody, and women in particular, obviously, because my focus right now is on helping women. But I really felt like Andrea had a story that everybody needed to hear. So I invited Andrea to do an interview with me, and she was kind enough to wholeheartedly agree to do so. So I really appreciate you for doing this, Andrea. Thank you so much.
You bet, my pleasure.
So anyway, I guess where I'd like to start, Andrea, is why don't you just give us a brief overview of, where you were, what was the before, what did the before picture look like, and what were some of the struggles and the walls that you were running into as you were trying to find answers?
Sure. Well, prior to working with Dr. Lena, I had seen lots of different doctors, from MDs to functional medicine doctors to really a myriad of people in the medical community. And a lot of my symptoms were really related to intestinal issues, things like that, just not feeling well. And mixed with what I thought was maybe, endometriosis or something female related. And so I would go to, my OBGYN, and then I would see a functional medicine doctor. I'm just trying to sort out whatever I could. And most recently, I was told that I probably had some colon issues and I should take a digestive enzyme. And from my OBGYN, actually, she had done some, ultrasounds and determined there was nothing wrong. And so she said, why don't you try taking that? And so I ended up doing some research and finding a digestive enzyme, and that process of a detox process and taking this digestive enzyme with a probiotic really put my body into a complete tailspin. I felt absolutely miserable. And at that point was really just, I was worried that there was something like seriously wrong with me. And so that, of course, led me back to my regular doctor. And so I would laid everything out. She says, well, there's nothing wrong with what you're taking. So, I don't know what else to tell you, but I had a lot of abdominal pain, like pain that started like underneath my ribs, that kind of wrapped around the side. And it was constant. It was forever and constant. And it didn't matter what I ate. It didn't matter what supplement I took. It just was not going away. And so I went through a whole host of, intrusive procedures. I had a CT scan, I had a colonoscopy, and just that whole period, like it makes me shake just thinking about it, because I was really concerned that something was seriously wrong. And of course, they all came back and said, you're fine, you're normal, everything looks good. And I just remember being like, okay, I've done everything that they've told me to do, and I still have this pain. I still don't feel well. And I remember thinking, am I going to feel like this for the rest of my life? Like, I'm young. Like, this isn't okay for me to feel like this. And, this was kind of at the end of, several years of going to doctors, not having this intense pain in my abdomen, but knowing something in my body was not right. And so I kind of felt like I was at the end of the line. Like I did not know where to turn. I did not know where to go. And I felt like I had exhausted all my options here locally that I could find. And so I was really left in a kind of desperate feeling situation. And before I found working with you.
So how long, like how many years did you go through the process of trial and error? And, and I know you worked in the conventional medical setting and you talked about all of the different procedures that you had. And, but you also worked with functional and integrative medicine people, I think more than one, right?
Yes.
And, they did they did testing of various sorts and supplements and all that kind of stuff. But I guess, so the first question is, how long was this process for you? And then, on the flip side of things, because a lot of people think, oh, well, conventional medicine is just bad. So we need to go the holistic route or the natural route because that's better. But I think one of the things that I wanted to point out to everybody using your story is to point out the fact that sometimes that's not always the right answer either, especially if those people don't know where to look. So can you talk a little bit about that?
Yeah, so the process for me probably was, I would say at least 8 years, maybe 10 years.
Wow.
That I, really walked this out to varying degrees. I would feel okay and just kind of put up with it, and then it'd be like, no, something's wrong. And so then I would dive back in, and specifically the functional medicine doctor that I went to, I thought, okay, finally, someone that's going to figure this out. And I went through a myriad of tests. I'm talking lots and lots of money. And, they had me do food testing. They had me on all kinds of supplements. And specifically, I remember they put me on L-glutamine. And I ended up just stopping it on my own. I felt so horrible when they put me on L-glutamine to repair my leaky gut. That I just felt like, if this is the only thing that's going to repair my leaky gut and it makes me feel like this, then I'm out. Like there's just no way. I can't live my life like that.
Mm-hmm.
And there was just a whole host of things that just weren't addressed at that time frame now that I know,
Mm-hmm.
differently.
Mm-hmm.
That functional medicine doctor just overlooked, or I just kind of got put into the system. What was interesting about that is that I had a very dear girlfriend that was going through working with this particular guy at the same time. And we both got put on the same stuff. And I just thought, I don't have what she has.
Right.
Why am I doing the same thing that she's doing? And it just occurred to me that this is just what they do. It's just, this is, everybody gets the same protocol. Everybody kind of just does this. This is what they know to do. And it works on some and it doesn't on others. And
Yeah.
so that's when I opted just to stop going there and stop working and stop taking the supplement and just, live like I had been before I went, because the supplement that they had put me on made me feel worse.
Mm-hmm. Right.
So.
And I think, had this person, and I mean, we're not picking on people, but I think one of the other things that I wanted to point out is that, there's so many different kinds of training programs out there, but there's no standard one. But even conventional doctors, I mean, technically we're all kind of trained the same, especially if we do internal medicine or primary care. But obviously that doesn't always dictate the level of expertise and proficiency and understanding things. So I guess I just want to point out that that happens regardless of the profession or the training of someone that they have. But kudos to you for figuring out that what you were doing wasn't working. But then you went back to your gynecologist and you said she was even, because a lot of conventional doctors now are trying to dabble in this other stuff because there's another revenue stream for them. So she recommended digestive enzymes, and she had to do a detox because, a lot of people just say, well, I'll just do a detox and I'll feel a little better. Well, again, it's so many different faces of the problem that you can't just do one thing or focus on one thing. And that actually made you feel worse, I think. Is that the case?
Oh. Yeah. And what was fascinating about that is, the people I worked with just said, you have a terrible leaky gut, and this is all the toxins coming out of your body. So take more of it. Take more of it. Yeah. And I'm like, I look back at that time, and there was 6 weeks of that time frame that were an extreme struggle for me. So I've never felt worse than I did during that time.
So, well, obviously we've worked together for about 3 months now. And I always tell people there's no reason really to get into specifics because again, everybody's situation is different and you're not like the other people that I work with. So, to a certain extent, you're right. You said everybody sort of gets the same thing. Well, yeah, okay. Everybody probably should take a probiotic. And most people probably should take a good multivitamin. But you're right. Beyond that, everybody has their own unique health issues that even though the symptoms might sound the same and look the same, they may be coming from something totally unrelated to what the other person is having. So, your point about that's really well taken. So, without necessarily getting into details, because that is kind of personal, I mean, what has your path been now since you started working with me? And again, not because I'm like the best thing on the planet. My kids would definitely argue with that. But just the change in the approach, I guess, and how has this been different than what you've done before? And what kinds of benefits have you derived, not just in your overall health and how you're feeling, but, moving forward from here?
Yeah, that is, that's a big question. And so, I just want to start by saying, I do, I so appreciate what you've done because it has been a completely different approach. And one that just has systematically over time peeled back the layers of what's going on with me. And it makes so much more sense. You started me with a very, basic approach and we did a detox, but then you did blood work and you were looking for specific things. And I think the thing that I admire the most about what you've done is that you took the time to listen. Like you took the time, like I remember being on the phone with you and you just saying, give me the whole story, right? Like give me everything. Which I did. And we started way back, right? Because, I very rarely have, sat down with anyone who's taken the time that you have taken with me to really understand what has gone on for the last 20 years that has been causing issues. And it was, you wanted that information. You weren't annoyed by me, giving you that information. You really used that information to look at the whole picture of me. And so that was the first thing that I noticed right off the bat. Like you genuinely taken the time and care and concern. And the other thing I would say also is that you can tell you're born to help women figure this stuff out. Like it is your gift. And so I just, from the very first time I spoke to you, I was like, this one's going to get to the bottom of it. And I could just feel it from our conversation, from the tone of voice you had, the conviction you had of, it doesn't matter what's going on with you. We're going to get to the bottom of what is happening. And, it brings me to tears, because I have never, ever had someone, care that much, that deeply. And so, I'm so grateful. And so that was the first thing I noticed. Next thing I noticed was, we did blood work, we did specifics, and you didn't have me doing the same thing other people were doing. Like it was, this is your treatment plan, and we dug down and there's several things that have presented themselves in symptoms in me. And it wasn't just one thing. It was really a combination of 3 to 4 things that I had going on that you have uncovered. And one thing, it might look like one thing, but it could be coming from this or this or this. And so very systematically, you have taken and added this or added that or added this or added that. And eliminated, some of the things I'm eating and, the supplements I'm taking. But it was all done very strategically and all backed by science, all backed by, this is what your blood work's telling me. This is what you think I have going on. That was the other thing. Like you told me right off the bat, this is what I think you got going on. And this is what I'm going to, look for in your blood work. And then it shows up. Right. And I think that's another very strategic difference from what other people that I've sat in front of have done to what you have done. And, really about about, I don't know what we decided, 3-4 weeks, I think, into working with you, I felt dramatically different. So the pain that I had in my side and in underneath my rib cage, it literally just went away. Like went away, and it has not been back. It has not been back since that time. And it's strategically, my brain fog has gotten better. I think clear. I've got more energy. I have more passion for what I'm doing. And what I've realized is that, you know, where I'm at today, in life and business and all of that, is really a result of a lot of not feeling as good as I thought I did. And I thought for so many of those years, it was just me. And it's so refreshing to know that I have my health back. So
that was really emotional and really moving. And I'm sitting here thinking, okay, people watching this, they're going to think Dr. Edwards probably paid her to say that. Because like I couldn't even come up with something that amazing and that thoughtful to say. I'm trying, you know, not to get emotional myself. Yes, doctors cry too, especially women. But I guess, you know, in closing, because you've got a lot going on, I'm really proud of you and really happy for you getting ready to adopt a little boy. Now you have the energy and you feel really great enough to do that. And but by the way, her skin looks like this even before what we did. So if you want to look like her, get a hold of her and she'll tell you how she looks like this. I was looking at her day thinking, oh my gosh, okay, I need to go completely redo myself because you look totally hot. And I'm like, frumpy doctor, which is okay because we discussed the fact that nobody really cares what their doctor
nobody really cares.
Anyway. So, but you know how women are. We're sort of like always self-analyzing, at least I am. So, but Andrea, what would you, I guess, as objectively as possible, what advice can you give to other women that are in the situation that you were in, as far as what they can do to get out of where they are?
I think one of the things that I would say is that just don't give up. Like, just like keep turning over stones, because, you know, I was in a pretty desperate place, thinking that, you know, at a pretty young age, I was not going to feel well for the rest of my life. And there was just something in me that knew there had to be someone that I could partner with that could help me figure this out. And so, you know, that's why I was in it for as long as I was in it, you know, and so I think that's my best advice is like, you don't have to feel awful every day, you know, and there are people that are equipped to figure these things out. And obviously, you know, Dr. Lena is one of them. And I would really encourage you just to continue pursuing your own health. And the other thing is educate yourself, you know, educate yourself on, and that's the other thing I would speak to what you've done is you've given us so many tools to educate ourselves so that, you know, we can really lead our own health journey, you know, and I so admire that piece about you because, you know, you are really equipping us and empowering us to be able to do what we need to do every day to feel great. And so I think what I would say is just, you know, seek out that information for yourself and be able to not give up on the cause because you don't have to feel like crap every day. There are people that can help you figure out what's going on and get to the bottom of it.
Yeah, a lot of my patients tell me that their doctors kind of get frustrated because they end up knowing more than their doctors do. I'm like, well, you know, you try to be educated as much as you possibly can because I was having this conversation with somebody earlier today. It doesn't matter if it's an attorney or a doctor or whatever. You still have to be educated enough to know because nobody knows everything. And sometimes I've gotten the wrong advice or bad advice. So, you know, the more you know about, especially your health, because, you know, you can always get another car and, you know, another set of teeth. I'm always amazed by how much people spend on their teeth. Anyway, but, you know, once your health is gone, it's really, really hard to get it back. So one of the ways I think that it's important to get your health and keep your health is you're right, is to stay as informed as possible and ask questions. And if you irritate your doctor, you're doing the right thing. That means you're asking them questions they don't know the answers to, which doctors don't like. So,
Right.
so anyway, well, I really, really appreciate you sharing your story.
Absolutely.
And, just letting women know that, there's ways for you to get out of the gutter, and, we're just trying to help them come up with different ways to do that. So thank you so much for sharing your story. I really do appreciate it.